All right, let's get right into it. Welcome, practitioners and clinicians. Look, if you have ever had a client present with just a tangled web of seemingly unrelated symptoms, maybe they have chronic fatigue, but also digestive issues, and there's some underlying anxiety all happening at once, you know exactly how frustrating it can be to hunt down the true root cause. Well, today, in this explainer, we are unpacking the complete holistic diagnostic and treatment system known as the 5-organ systems. This is absolutely crucial. It's the foundational theory that's going to turn those abstract, confusing symptoms into a crystal clear, actionable clinical roadmap. So here is our game plan for today. First, we'll establish the 5-organ foundation. Second, we'll decode body energy states. Third, we're mapping out the 5 systems themselves. Fourth, we'll explore organ interactions. And finally, we'll wrap up with the diagnostic principle. Let's just jump right in. Okay, section 1, the 5-organ foundation. This is our core diagnostic theory. What's really fascinating about this framework is how it totally reframes our standard allopathic understanding of anatomy. In this holistic system, you have to remember that organs are not just isolated anatomical structures just sitting there in the body. They are incredibly dynamic functional networks. And what that means is every single symptom your client experiences, whether we're talking a hormonal imbalance, poor immunity, or even a deep spiritual disconnect, it can all be traced back to one or more of these organ imbalances. As a practitioner, realizing that the physical, mental, and emotional are all governed by the exact same unified network, that is your first major key to effective treatment. Moving on to section 2, let's talk about body energy states, specifically understanding qi and yin. Now, before we look at specific organs in the clinic, we absolutely have to get a grip on the core energies that power them. And I know, when you're explaining these concepts to clients, the terminology can feel, well, a little abstract. So the trick is to make it tangible. I want you to literally imagine your client's body is a house. This analogy is a total game changer because it makes these abstract energy concepts incredibly vivid and sticky, both for you and your practice and for your patients. Let's look at how this house operates. First up, we have qi. Qi is the electricity, right? It provides the vital power for absolutely everything to function. Next is yang. Yang is the body's heater. It's that warming, activating, energetic aspect of the house that keeps things moving and comfortable. Then we have yin. Think of yin as your water and cooling system. It keeps the house moist, cool, nourished, and keeps it from overheating. And finally, sinking qi. These are your structural support pillars. It's the energy holding organs in place and keeping everything properly lifted. So, keep this whole structural analogy in the back of your mind during your patient intake. Listen closely to what they're saying to figure out if their complaints sound like a plumbing, heating, or electrical issue. Because, think about it, when that electricity fails, we get qi deficiency. Put simply, the body's battery is just blinking red. In your clinic, this is the patient who comes in complaining of just deep, heavy tiredness, zero motivation, and a poor appetite. You know the type. They might have a really weak voice, or they'll tell you they're exhausted after the smallest little tasks, like walking up a single flight of stairs. They're probably catching colds constantly because their protective energy, their immunity, is simply too weak to defend the house. And this brings us to a brilliant way to see the difference between our temperature controls, yang and yin. If your client has yang deficiency, their heater is broken, period. They're going to present as cold and slow. We're talking cold hands and feet, sluggish digestion, frequent urination, water retention. These are the people wearing a thick sweater in the middle of summer. On the flip side, if a client has yin deficiency, their cooling and moisturizing system is totally depleted. The house is drying out and overheating. You're going to see dry skin, dry mouth, night sweats, restlessness, and insomnia. Recognizing these two extremes is absolutely essential for quick pattern recognition in your practice. All right, section 3, the 5 systems. These are your core organ networks. Here is the 30,000-foot view of the entire interconnected network. We have 5 main systems, and each one is paired with an associated bowel, a primary physical function, and a core emotion. The spleen pairs with the stomach, and together they govern digestion and the emotion of worry. The liver pairs with the gallbladder, controlling energy flow, detoxification, and anger. The kidney and bladder, they manage vitality, reproduction, and fear. The heart and small intestine control the mind, circulation, and joy or shock. And finally, the lung and large intestine handle immunity, respiration, and grief. In the clinic, use this map to connect the dots between seemingly unrelated things. Like if a patient presents with chronic digestive trouble, you should immediately ask them about their daily worry and anxiety levels. Let's zoom in on the spleen and liver for a second, because you are going to see this constantly in modern clinical practice. The root causes of imbalances here directly bridge external habits with internal health. The spleen is just decimated by excess sugar, processed foods, overeating, and chronic worry. It literally weakens their digestion and energy production. Meanwhile, the liver is thrown out of whack by chronic stress, repressed emotions, toxic exposure, and a poor diet. If you have a patient working an 80-hour week, eating terrible food, and swallowing their frustration, they are creating the absolute perfect storm for a liver-spleen clash. To really help you spot this in the clinic, let's contrast these two opposing presentations. A client with spleen-yang deficiency is going to come in with a cold body, chronic diarrhea, bloating, and water retention. Their digestive fire is just out. Now compare that to liver fire rising. This client is hot, they're agitated, and everything is moving upward. They present with severe migraines, explosive anger, a red face, insomnia, maybe some ringing in the ears. These are two completely different clinical pictures that require totally different treatment approaches. Now, we can't forget the emotional triggers for the remaining systems, because deep emotional experiences can absolutely be the primary root cause of a physical imbalance. The kidney is deeply affected by fear, insecurity, and anxiety. So think of that exhausted, chronically anxious patient. The heart is unsettled by shock, emotional trauma, or just being emotionally overstimulated. And the lung system? It takes a massive hit from chronic grief, sadness, and profound loss. That persistent dry cough or a sudden drop in immunity you're seeing might actually be stemming from unresolved grief. Okay, let's hit section 4. Organ interactions. This is how the systems connect. No organ works in a vacuum, and this is exactly where the holistic model is a lifesaver for complex, multi-symptom cases. The spleen supports the lung, meaning strong digestion actually creates strong immunity. So if a patient has recurrent colds, you might actually need to treat their gut first. The liver supports the spleen. Healthy energy flow improves digestion. The kidney supports the heart, meaning strong core vitality anchors emotional stability. The lung supports the kidney, and the heart supports the spleen. By understanding these arrows of support, you can trace a symptom back to its true origin instead of just putting a band-aid on the surface complaint. As a practitioner, if you're treating an organ directly and you are just hitting a wall, pivot. Use this chart to treat the supporter organ to jumpstart the healing process. And finally, section 5, diagnostic principle, evaluating your client. This right here is your literal clinical checklist. It is the ultimate roadmap for evaluating your next client. Every single client should be assessed using these 5 steps. Step 1, identify the primary organ causing the bulk of the symptoms. Step 2, identify the secondary organ contributing to the condition based on those organ interactions we just talked about. Step 3, define the pattern. Are we looking at heat, cold, dampness, dryness, or stagnation? Step 4, assess the severity. Is it mild, moderate, or severe? And step 5, pinpoint the root cause. Is it their diet, lifestyle, unresolved emotions, environmental exposure, or chronic disease? Stick to this framework, and you literally will not miss a piece of the puzzle. So practitioners, I want to leave you with this thought. The next time a client sits down in your office complaining of fatigue or night sweats or chronic worry, which organ system will their symptoms point to first? Armed with this 5-organ systems theory, you now have the tools to look way beyond the surface, map the energies, and truly heal from the root. Thanks for joining me on this explainer, and I'll catch you in the next one.